If you've seen the recent BBC investigation into infant sleep consultants, you might be feeling one of two things, either horror or confusion. Because on one hand, there were examples of advice that were genuinely dangerous, and on the other, many families have had really positive, supportive experiences with sleep professionals. So which is it? Is the sleep industry unsafe, or is this a case of a few bad apples? The truth is, it's both. And for those working with families or training to do so, this conversation really matters. Hi, I'm Lyndsey, co-founder of the Holistic Sleep Coaching Programme. I'm a paediatric nurse, health visitor, IBCLC, and I've spent decades supporting families with feeding, sleep, and infant development. I also train sleep professionals all over the world, so I sit in a slightly unusual position. I understand the clinical world, and I understand the sleep coaching industry, which means I can see both the strengths and the gaps. And this BBC investigation brings both into very sharp focus. Let's start with the obvious. Some of the advice shown in that investigation is not just questionable, it's dangerous. Advising a newborn to sleep on their front directly contradicts international safer sleep guidance. It increases the risk of sudden infant death. That is evidence we have had for decades. Suggesting placing towels or muslins into a cot introduces risks of suffocation and overheating. Again, not nuanced, not debatable, unsafe. There are some things that simply are not up for discussion. Safe sleep is one of them. Now, here's where it becomes even more concerning. This kind of advice is incredibly easy to give. These consultations happen privately, on Zoom, on the phone, in someone's home. There's no oversight, no routine review of practice, no governing body checking what is being said. Someone can present themselves as an expert, charge significant fees, and give advice that is unsafe or entirely out of scope, and nobody has to know. We also need to acknowledge the context in which this support is sought. Families reaching out for sleep support are often exhausted, overwhelmed, under significant pressure. That creates vulnerability, and within that vulnerability, confident messaging, certainty, and strong claims can carry a great deal of weight. This is not about blaming families, it's about recognizing the conditions in which advice is being received. However, this is where balance matters, because this investigation risks flattening the entire sleep support space into one negative narrative, and that's not accurate either. There are practitioners in this field who are safe, ethical, and deeply knowledgeable, people who understand scope of practice, people who do not diagnose medical conditions, people who refer appropriately, people who centre attachment, regulation, and responsiveness. Many of these practitioners are people I've trained, so we have to hold two truths. There is unsafe practice and there is excellent practice. Both exist. For me, a significant part of the responsibility sits with training providers. If you are educating sleep coaches, you are shaping how they will support families. So training should include safe sleep, clear scope of practice, appropriate referral pathways, critical thinking, ethical responsibility, and an understanding of how to support families without exploiting vulnerability. This is exactly what we do inside the Holistic Sleep Coaching Programme. We focus on safe, responsive, developmentally appropriate care. We build confidence, not dependence. Another piece that is often overlooked is mentorship. As a clinician, I have always worked within systems that include mentorship and supervision as standard, because no matter how experienced someone is, there will always be cases that are complex, unclear, or outside immediate confidence. Sometimes you need to talk it through. That is why we provide twice weekly clinical supervision and group coaching for all of our students, past and present. There is always a space to ask questions, to sense check, to make sure nothing's been missed. This is a safeguarding measure. Not every training program offers this level of ongoing support. So when practitioners encounter complex cases, and they will, the question becomes, where do they go? Who do they check in with? Are they just blagging it? In an unregulated space, we simply do not know. So this brings us to regulation, which is the obvious solution many people suggest, and it's understandable why. If there's concern about a nurse, you go to the Nursing and Midwifery Council. If there's concern about a doctor, you can go to the General Medical Council. If there's a concern about hospital care, there are formal pathways like PALS. If there's a concern about a sleep consultant, there's no equivalent structure. So the call for regulation makes sense to protect the public. However, it's not straightforward. Who defines good practice? If regulation sits within clinical frameworks, we need to acknowledge that many clinicians will default to behavioural sleep training approaches, largely because that is where the strongest body of randomised controlled trial data comes from. But that evidence base is limited. It doesn't fully capture attachment, regulation, or long-term relational outcomes. Equally, those working within behavioural models would probably not welcome regulation from practitioners who centre responsive attachment-focused care. So regulation risks reinforcing one narrow model rather than embracing the full complexity of sleep. It's also important to recognise the wider system context. NHS services are stretched thin. Professionals are under significant time pressure. And while health visitors, GPs and paediatric teams provide essential care, there is often limited capacity to sit with families for the length of time required to fully explore and support complex sleep situations. Sleep support is not always a quick conversation. For some families, it requires detailed listening, pattern recognition, emotional support, and time. This is where sleep services can play a valuable role. They can fill a gap that is not consistently met within existing systems. Not every family needs a sleep coach. Some will feel reassured with brief guidance from a trusted health professional or evidence-based resources such as BASIS or the Lullaby Trust. That's absolutely appropriate, but some families are struggling more deeply and they may benefit from more personalised, in-depth support. These families deserve support that is safe, holistic, compassionate, and realistic. All this leaves both professionals and families navigating a complex landscape. Training quality varies, support structures vary, definitions of expertise vary, and the burden of discernment is often placed on those least equipped to carry it. So where does this leave us? Unsafe practice must be called out clearly, confidently, without hesitation. At the same time, we must be careful not to dismantle an entire field that at its best provides thoughtful, compassionate and highly skilled support. Sleep support, when done well, is nuanced, it's relational, and it sits within the broader context of family life, development and well-being. Families deserve support that reflects that complexity. Not oversimplification, not unsafe advice, not fear-based messaging. If you're a professional or considering working in this space and this approach resonates with you, this is exactly what we teach inside the Holistic Sleep Coaching Program. Click the link below to learn more, and if this video has helped bring some clarity to a complex conversation, share it with others working in this space, because what we need more of here is not louder voices, it's better ones.